We have the pleasure to chat with Dr. Glaser from Owensboro Health. Good morning.
Good morning, Chad.
So let's begin. Obviously, October, Breast Cancer Awareness Month. What changes have you seen in the treatment of breast cancer?
The treatment of breast cancer has evolved tremendously in the time, just the time that I've been practicing in the last 22 years. When I was a young surgeon and in training, that most women with a lump in their breast would have a biopsy that lump, and if it was cancer, we would move straight on to a mastectomy, and there was no questioning that. That's the way things were treated. And now the majority of women with breast cancer do not have to have a mastectomy. Most of them are able to save their breast, and that's much better. And the treatments are much less invasive, much less deforming, and much more successful. Women do better. The survival rates for breast cancer have increased over the last 20 years because of our use of multimodality therapies and early detection. And these are just all great things. A woman today has a 90% chance of surviving her breast cancer 10 years after she's diagnosed.
With ever-changing therapies and treatments, how do you keep up to date with everything that's new?
Well, I think as a breast surgeon, you have to make a commitment that you are going to keep up with these things. And I am a member of the American Society of Breast Surgeons and the American Society of Breast Diseases, and attend both of their annual meetings. And you just have to, because the treatment of breast cancer evolves at a very fast pace. And you can't just sit back and rest on your laurels. So I've made that commitment that, I'm going to make sure that I stay up to date. And so every year I'll spend 2 or 3 weeks at a meeting somewhere to, make sure that I do stay up to date on those things. And, of course, there's an awful lot of journals and reading that you have to do as well.
So, Dr. Glaser, what are your main priorities when you treat your patients?
I think it's first important that you try to help the woman understand that there are goals of treatment and understand what her goals are. And I try to make sure that I'm straight up and honest with them and tell them, if things are good, they're good. If they're bad, they're bad. But at the end of the day, it's a team decision. We have to work together on this and go through the various treatment options. I have to make sure she understands what that is, because she has to make a decision about how she wants to proceed. I think that today we can almost always tell a woman that she'll be able to save her breast, that she'll be able to survive her breast cancer, and we want to make sure that at the end of the day she is just as confident with her appearance as she was before surgery, and that about sums it up.
So tell me about the One Health team approach to treating patients.
Breast cancer is definitely a multimodality therapy. You just don't go see a surgeon and have surgery and it's done. You need a radiologist to help support you with their ability to perform mammograms and MRI scans and ultrasounds. They do some of our biopsies. I do some of the biopsies using image-guided needle biopsy techniques. Our medical and radiation oncologists play an integral part. Sometimes women actually have to have some sort of chemotherapy or hormonal therapy even before surgery, and then ultimately, the surgeon removes the tumor and checks the lymph nodes. And then we also have the intervention of our plastic and reconstructive surgeons, because sometimes women need or desire to have a mastectomy and would like to have their breast reconstructed, and we're really fortunate to have 2 really good plastic surgeons in town who it's just really easy to work with these people, and they help us out a lot. And then we didn't even mention the role of the family doctor and the obstetrics and gynecology doctors who make sure that these women are getting their mammograms and make sure that they're getting referred to the appropriate people if they should have an abnormality or a lump. And so, there's probably not many other topics in medical care where a team approach is as important as it is in the treatment of breast cancer.
Mentioned that October is Breast Cancer Awareness Month, and this final question is all about awareness. What do women need to know about finding and preventing breast cancer?
Well, there's a number of things a woman can do for herself to try to decrease her risk of breast cancer. For instance, something simple as weight loss and exercise. This has been shown multiple times recently in very well-controlled prospective studies that modest weight loss and regular exercise decreases a woman's risk of developing a breast cancer. And even women with breast cancer do better when they exercise regularly. Cigarette smoking increases your risk of developing a breast cancer by 16%. So, you really need to avoid smoking. And recently there's been some new guidelines that came out from the American Cancer Society in regards to how often a woman should get a mammogram or when she should start screening. And honestly, I think this hit the newspapers day before yesterday. They haven't even been released to the medical community yet, and so I haven't had a chance to digest those. But at the end of the day, mammograms are vitally important. We hardly ever see a woman with a bad breast cancer as long as she gets her mammograms as they are recommended. And some women fear the radiation. You actually get less radiation from a mammogram than you do flying from New York to Los Angeles on a jet. If a woman gets a mammogram every year from the age 35 to 70, she gets less radiation from all those mammograms together than she does one CAT scan. And so women should not fear mammograms. They really need to get them, because I think it's very often the difference between a woman who is going to do very well after developing a breast cancer as opposed to a woman who isn't going to do that well. Regardless of what the new recommendations may be, it's important that women should follow those recommendations.